These two pieces of work came out of the 12-month project, and I'll introduce you to Professor Nick Lennox in a moment, who we partnered with specifically around the training for GPs, as they'd done so much work before and lead up and had done a lot of work with GPs around what they needed as well. But out of the 6 months of scoping and working with organisations and families and carers, one of the key themes was around exactly what Sue was talking around making sure when they went to see GPs that they didn't feel like they were adequately equipped or had the necessary supports around being able to talk to people with intellectual disability. So when that theme came up, what we wanted to do was leave the project with something that not only reached GPs in Metro North area, but something that could be used nationally. So I think it's been great that it is eligible, that all GPs are able to access it. And what I'll do is introduce Nick now to speak a little bit more in detail around that specific part of the project.
Thank you for the introduction, and thank you, Sue. And I'd like just to pay tribute to Sue, who I think has been driving the issues for many years. In fact, one of the first speeches I ever made in Queensland was because of Sue's voice. And my now 20-year-old was playing next to me at the time as a 2-year-old. So this, like Jane, I'm actually a fraud here. It's actually Miriam Taylor that did all the work from QCIDD's point of view on this. And Miriam's in Malaysia, so she finds it difficult to attend. But you know, it's been my life work for the last 22 years to try to work between that health and that disability interface and try to drive change where there has been enormous reluctance for change. I belong to the medical profession and also the research profession actually, but it's very difficult to get engagement from the medical professions. That GPs face numerous challenges, one of them being time and ability to communicate well to try to deliver good health care to this population. I'm allowed to be. I assume there's no other GPs in the room.
There's only 5.
Okay, so there's 2 modules came out of this, and truly this was driven by Miriam and her enthusiasm, and also the NDS and the Medicare Local to bring this together and actually drive a module for GPs. As a GP, every year I have to do a certain number of points, which is working better than the point on this one. I have to do a training, continual medical education, and this is a package designed, which is very common in general practice now for general practice practitioners, to gather numerous points during a triennium period. And you can see this is the type of module, a 12-module course. It's very internet enabled. It uses visuals where possible. Some of them somewhat disturbing because they're videos of me, but otherwise they're quite good. And lots of good information, and we'll just keep going through it, and we'll just, so there's there's a questionnaire for them to get some idea of where they are in terms of their understanding of knowledge, and such important issues as SUDEP, or sudden unexplained death from epilepsy, which is an extraordinarily important issue. The mortality rate with epilepsy and complex epilepsy over time is startlingly disturbing, and if we could improve this alone, we would massively improve the lives of people with disabilities. There's the disturbing video. We can move right on. Thank you.
It comes with the warning.
And you can see the type of areas, introduction and healthcare of adults with intellectual disability. And the healthcare is what Sue was actually alluding to, is in fact that people have 5.4 conditions, half of which are unmanaged or if not, or unrecognised. And they have an early mortality up to 20 years earlier if they've got a severe or profound intellectual disability, and 7 years earlier with a mild intellectual disability. These are very bad health statistics. So we just move through, and these are the type of things they encounter, and you work your way through this. I've done this, of course, and you work. They didn't give me any points, but anyway, they work through it and answer questions along the way. So it reinforces your learning throughout. All web-based, all available to GPs. GPs, believe me, are busy, and therefore they need to fit things around their lifestyles, which is not all about golf. If we keep going forward, you'll see this is that type of thing. So in the first slide, it actually suggests it was possibly available to all health practitioners. If you email Miriam, she can give you access to it. I'm not sure about that actually, yes, if it's available to all health practitioners, but I suspect we could make it do that quite easily. If we move on, the other thing that Miriam worked on is raising good health and wellbeing for support workers, support worker training. And it's true that in the lives of many people, not all, but many people with intellectual disability, they rely on proxies to engage with systems. And the proxies are absolutely crucial in this process. And many, many times I've seen proxies who have not been very good proxies, to be frank. And if that's the case, then simple things can be easily missed. Simple things can be easily missed if you don't provide me as a medical practitioner with a decent story, even if you don't have an intellectual disability. So the story, the discourse, your personal narrative about your experience of life and your health is crucial to me arriving at a diagnosis and therefore making any reasonable judgment as to what I should do. And so the support workers are absolutely crucial in trying to provide that proxy. A tough task, done well, it is phenomenal. Done badly, it's possibly lethal. So there's a training scheme here, if you move forward these various modules about good health and wellbeing. It can be either self-paced or it can be delivered on a face-to-face workshop with various PowerPoint workbooks, guides and resource booklets. And these are the topics that are covered, the typical type of things you'd imagine in terms of chronic conditions, and certainly they have lots of chronic conditions, lots of emotional and psychological issues, which are very difficult and complex to tease out, and you see the whole list of these things, including health assessments. I will mention health assessments. The health assessment process, or the comprehensive health assessment tool, was developed in Queensland. It's the only tool that's been clearly demonstrated using randomised controlled trials that it actually improves the health of people with intellectual disabilities. In fact, Eric Emerson said it's the only thing that he knows, this is a world expert, that actually improves the health of people with intellectual disability in the world, and now being implemented through most of Australia, and unfortunately is at risk of disappearing with the NDS, but we're working on to make sure that doesn't happen. So that's the health assessment tool that's available and GPs have gone. And this is a project, again, for the vision of Metro North and NDS, and working and pulling us in to develop this. It's fantastic. I mean, it's a fantastic collaboration. I'd like to see more of these collaborations come together, because the NDS and Metro North have got skills and contacts which we just don't have as a university centre. And I think that's all. Thank you.